treatment, a drug called Paxlovid, and I know there are generic names for it as well. A fair amount of confusion about who should be taking it, who shouldn't. There's a sense that it's not available to many people who need it. It does require a doctor's prescription. We are told that it is available, but it's not reaching everyone who needs it. What should we know about this drug?
We are underutilizing what is a highly effective therapy. In clinical trials, when you looked at the proportion of individuals who were protected from getting on and progressing to hospitalizations, it was close to 90%. So we need to do more. There are a lot of those doses available. We have sites where you can, as we say, test to treat, which means you can come into a place, get tested, and if you are tested, immediately get put on therapy if they're eligible. We've ordered tens of thousands more of these drugs, namely Paxlovid, and we're having sites where we started off with 20,000 sites have Paxlovid available. We're increasing that to 30,000 with the aim of going to 40,000, essentially doubling the number of sites where you can get it. And I mean pharmacies and clinics and places like that, as well as something that's important that you alluded to, is educating the public and the healthcare providers that this is something that is available and that should be much more widely used.
Dr. Fauci, let me broaden this out and ask you, here we are, it's the end of April, it's the spring of 2022. How close are we to the end of this pandemic?
Well, that's an unanswerable question for the following reason. And I don't want to be evasive about it, but let me tell you why I'm giving you that answer, Judy. We are certainly right now in this country out of the pandemic phase. Namely, we don't have 900,000 new infections a day and tens and tens and tens of thousands of hospitalizations and thousands of deaths. We are at a low level right now. So if you're saying, are we out of the pandemic phase in this country? We are. What we hope to do, I don't believe, and I've spoken about this widely, we're not going to eradicate this virus. If we can keep that level very low and intermittently vaccinate people, and I don't know how often that will have to be, Judy. That might be every year, that might be longer, in order to keep that level low. But right now, we are not in the pandemic phase in this country. Pandemic means a widespread throughout the world infection that spreads rapidly among people. So if you look at the global situation, there's no doubt this pandemic is still ongoing.
Dr. Anthony Fauci, thank you very much.